a little bit about the importance of eye health. So, this has been something that I've learned a ton about in just the last 2 months, really, is how much the organization I work for now, Bridging Voice, has done in terms of looking at the data of people who are using eye tracking devices and how different eye conditions can really have an impact on how people can use eye tracking. And so, um, just kind of an overview of what I'm going to go through today. I'm going to talk a little bit about Bridging Voice. I know that I think I know everybody, and so I was very sad to leave the ALS Association, and just want to give a little bit of information about the new organization I work with, Bridging Voice, and how we might be able to help support people. Um, Really looking at what is eye tracking and why it's important for people with ALS in particular. Um, I'm going to be focusing a lot on dry eye. So, what are kind of the symptoms that you'll see of dry eye, and what could some potential causes be, particularly with people living with ALS? How dry eye can impact eye tracking, and then what potential treatment considerations there are, and that you might want to discuss with your ALS clinic team. So, feel free to interrupt me at any time. You guys know me, and just if you have questions, you can pop them in the chat or you can unmute, whatever works best for you. So, um, first, Bridging Voice. So, the new organization I work for is called Bridging Voice. It is a nonprofit as well, and we support people living with ALS. Um, to access communication devices and assistive technology. And we do it through a bunch of different ways, really providing education, whether that's just to the people living with ALS and caregivers or to professionals as a whole. Um, we do training, particularly on a lot of the systems. One of the big gaps that we can see with communication devices is a lot of times people will get one, and then it's like, okay, well, you got it. Here's maybe a 1-2 hour training and then good luck. And so one of the things that Bridging Voice does really well is providing ongoing training and really helping to support people. We provide technical support and customizations that are a little bit unique. We have a team that is made up of speech pathologists like myself, occupational therapists, and then programmers or technologists. So our programmers are absolutely fantastic, and they make a lot of really unique customizations to people's communication devices to be able to maximize how much they're able to use their communication device and for how long. And so it's really through kind of some of those unique pieces that um, that Bridging Voice emerged. Um, it is a nonprofit, so all services are provided free of charge. We are 100% remote, so um, one of the benefits that we have is we can dial into people's devices. So if you have a communication device, we can actually log into it and we can make changes on our side and kind of help with that, which can be really helpful. Um, I'm relatively new to the team. Obviously, I joined 2 months ago, but the organization itself is just over 5 years old. And during those 5 years has helped 2,700 clients with ALS all across the United States, and in some other countries as well, and provided over 25,000 services. So really it's always about what is going to be best for their person. So, if somebody's needing to meet weekly, we'll meet weekly. If someone just needs to meet every once in a while, that's something we do too. So it's really led by what people living with ALS need to be able to communicate. So um, one of, I think, the big pieces of um, what we consider when we're thinking about communication for people living with ALS is that a lot of the times people living with ALS will need to use eye tracking at some point. And at that point, it can be the only form of communication and connection to kind of people around you, to the outside world. And so it's a very important piece of everything that we consider. Um, and one of the pieces that's important to know is how do eye trackers work? And so all eye trackers have, and let me see if I can get a little dot on my screen so you can see. So, oh, red is a horrible color for this. That's okay. But all eye trackers have this um, eye tracking camera at the bottom that puts out near infrared light or IR. And what that IR um, light is reading is it's looking at the center of your pupil, and then it's looking at this little reflex called the corneal reflex that is also called the glint. So what is this reflection that's coming off your eye? And so it looked at those 2 points, and based on the relationship of those, that's how it determines where your eye is looking around the screen. And so it's really important that the eye trackers can find both the center of your pupil and this glint. And so when we're thinking about that in terms of dry eye, that can be really tricky because it might cause a difficult time finding that glint, which can then make it difficult for the eye tracker to be able to read where you're looking on your screen. And so some of the symptoms of dry eye are things you would typically think of. I think a lot of us know, you can expect redness or stinging, itching, uh, light sensitivity, but some of maybe the less common ones are actually watery eyes. So a lot of times people think like, oh, my eyes are so watery. I don't, I have too much water. It's not that my eyes are dry. And the wateriness is actually a symptom that your eyes are very dry, as can mucus near the eyes. Um, you can also see things like blurry vision, and difficulty accessing a communication device. So um, when we think about all of these pieces, um, there really can be a number of different reasons why people living with ALS are having dry eye, maybe more than people in the typical population. The first is really thinking about medications. So um, a lot of times the medications that we take when you have ALS to help treat some other symptoms can have an impact on the dryness of your eyes. And so allergy medications with antihistamines can actually part of the way that they work is by drying up the mucus and drying up um, secretions. And so that's making your eyes drier. And same with any saliva reducing medications. So we see a lot of people can be on these, especially if you're having, drooling. And so things like if you take atropine drops or have a scopolamine patch, or take glycopyrrolate, sometimes those medications, in addition to drying up your saliva, can be drying up other mucous membranes, including your eyes. Um, in addition to kind of some of the medical medication impacts, we can also see that just the motor impairments of having ALS can sometimes impact how wet your eyes are as well. So we know that people living with ALS often have a reduced blink rate at some point. And sometimes people can have a reduced ability to completely close the eyelid. And what happens when you close your eye is that there's oil glands at your eyelashes that are allowed to secrete and then help make your eyes wetter. And so when you're not able to completely close your eyes, it's reducing the amount of wetness you're getting. One of the things, Sherry, that you had kind of brought up earlier too was like BiPAP or non-invasive ventilation masks. So we actually see this more commonly in just the fit of the mask, that it can be hard to get them so that you're not getting any air escaping. I think a lot of times people will feel air escaping, on their chin, but sometimes it is escaping directly into the eyes as well. And so obviously that is going to be causing a drying process. Um, one of the things Sherry had brought up before too is that one of the doctors had thought that it could be restricting the airway as well, which is an interesting thought. Not one that I had kind of thought about, but definitely something I think to be mindful of. Um, and then the other piece too, and this is, less maybe specific to ALS, but just in general, we can see that people who have had a history of eye surgery, like LASIK or cataract removal, also tend to have drier eyes. Um, some of this can be due, like short term to like nerve damage just from, you know, doing the actual surgery itself. Um, some of it can be due to the fact that it's thinning the lens too, or changing the shape of the eye. And so then that changes kind of tear distribution and how things can really maintain that wetness. Um, and it's really just variable across kind of, we have some people who've had surgery who never have issues, and some people who do notice dry eye right away. And so when we're thinking about dry eyes, for a lot of people, it can just be kind of a quality of life piece in terms of, can be uncomfortable. But when we think about it for people living with ALS, we also know that sometimes that can really be a lifeline for communication and for access to communication long term. And so it's really important that we're thinking about eye health, you know, not just when you're using an eye gaze device, but even before you need it, just to make sure you're being proactive about it. Um, and so in this picture, you can actually see this is an individual with severe dry eye, and you can see how watery her eyes are, and you can actually see tears coming out of the center. But um, the majority of her dry eye was caused by an inability to completely close her eyes. And so I'll talk later about some potential solutions that we've seen for people who have kind of this progression. Um, I will say this is not definitely not everybody sees this, but just something to kind of keep an eye on. Um, and so in addition to some of those symptoms that you might see, um, things like, the watery eyes, redness, stinging, all of those pieces, one of the other things that you can really see when you're using a communication device is we can see how we see dry eyes pop up in a number of different ways. And I'll show you kind of what this looks like when someone's using a device in just a moment. I have a couple of videos. Um, but before I kind of go through the bullet points, what you see on the screen here, so I'll start with this one on the bottom, this black box. This is something that's really common on a lot of the communication devices. And what it's doing is the two white dots are the eyes. And then this bar along the side is showing how far or close the device is to the person's face. And so when you're wanting a device to be in the right place, you really want it to be about 2 feet, typically 2 to 3 feet, depends on the device. And so we'll see this little white triangle. When it's in that green zone, it's showing us like, perfect, that's the great distance. And having those two solid white dots shows us that it's reading your eyes. It's able to read both the pupil and the glint. So it has a really solid view of your eyes. This one up here with the face, this is just another kind of a device, a different eye tracker, and how it shows. And you can see again, the two eyes are the eyes. And typically with this one, you'll see that the face is either green, yellow, or red. So similar to kind of this distance indicator, it's just the whole face turns a different color. And so even if somebody is not experiencing any symptoms, so they're not experiencing stinging or redness or watery eyes, anything like that, we also sometimes can see dry eye pop up on a communication device. And we do that we might see these eyes flickering in this track status. So in here, you can see these are two really solid white dots. In somebody with dry eye, you might see one eye kind of blinking in and out. You might see them both blinking in and out. They're not steady. even though the person is not moving, typically you'll see the eyes kind of blinking in and out. Um, you'll also see that with this little triangle moving up and down. So it might just like typically it'll stay steady based on where you're sitting. But if, again, you have dry eyes, it's having trouble picking up that glint. And so it's going to keep jumping up and down, trying to figure out where your eyes are. Um, and then these next two are really ones that we'll see in a couple of videos that I have, which is when you're using an eye gaze device, you typically are given like a kind of like a mouse to show you where you're looking on the page. And you might see that someone has dry eye because that cursor might be jumping all over the page, even though they're looking at one spot. And you can also see that when you're having difficulty selecting in a really specific area. So for example, maybe it's like bottom right corner of the screen. You can get everywhere else on the screen, but that bottom right corner is really tricky. Um, and so in this video, um, this is someone showing kind of, this is him with dry eyes. And what we had him do in this video is we want him to go across this middle row. So just one letter at a time. A, S, E, F, G, H, J. And you'll see that there's this red dot, and that's showing where the eye tracker is reading his eyes on the screen. And so I don't believe there's any sound with this one. So if you're not hearing anything, that's normal. Let's just take a look at kind of what this looks like. Okay, so here he goes trying to get the A. Now he's trying to get the F. Still trying to get the F. He's looking right at that F. Now he's going for G. Now that was him going back and basically showing that he can't get to those pieces. And so now in this next video, let's see if it's gonna let me. We had him put in eye drops and then wait about 5 minutes and then have him do the same task. So go across this middle row, ASDF. And so you can see that just that small change of having eye drops and having eyes that aren't as dry gave him the accuracy to go all the way across that row. Whereas before, he was jumping all over the place when he was trying to get that F and that G. And so, um, in a task like this, obviously, this isn't something you're going to be doing all the time on a device. But if you're trying to type out a message, you're trying to type help, and you can't get to the 8 because your eyes are jumping all over the screen, it can have a really big impact. And so that's why we really are thinking a lot about, how are we making sure we're maintaining really wet eyes to help make sure that things are working properly. And there are a lot of other customizations and things that we can do to change up how the keyboard looks, to change up everything else. But something as simple as just having an eye drop can have a really huge impact on how you're communicating. And so when we're thinking about kind of different treatment solutions for dry eye, there are some pretty, I think, self-explanatory ones. So we think about eye drops a lot. We have been working with an ophthalmologist out of Oregon State who is doing a lot of research in this area and has been finding that using eye drops like 3 times a day, if you're using or if you're noticing those dry eye symptoms, can have a really big impact. Um, Typically, when we're thinking about eye drops, we really recommend using ones that are preservative free. And so I'll show a handout in a little bit too of specific brands and considerations that he's had, but really thinking about ones that don't have allergy or any antihistamines in it, because those can actually, even though they're meant to kind of help hydrate the eye, they can actually be dehydrating and still cause that dry eye because it has that antihistamine. Some people also find that using compress regimens can be really helpful. So again, um, having a warm compress on your eyes at the end of the day, maybe like 30 minutes, can be really helpful in maintaining that moisture. Um, in some cases, people find changing medications. So, again, this is something we would never recommend without discussing with your physician, but maybe looking at a different saliva reduction medicine or looking at a different antihistamine or something like that might be able to help make some of those changes as well. Um, and then one of the other ones that we've seen lately too is scleral lenses. And that's this picture that you see kind of down in the bottom right. And scleral lenses are kind of that solution that I was talking about for people who are maybe having difficulty completely closing their eyes. And so you can see in this picture actually a gentleman wearing scleral lenses. And what it is it's like a contact lens, but it has like an eye drop solution in it that is keeping your eyes moist throughout the day. And so the way that they put those in, can I go back? You see, they'll use like this little suction cup thing that kind of help people, caregivers can help get those in. What it does is it'll just keep that moisture constantly on your eyes throughout the day so that you're not having to apply eye drops every like 5 minutes, because obviously that's not realistic for anybody either. Um, but this is something that for people who are maybe having some of those more extreme cases, you're doing compress regimens, you're doing eye drops, and things are still, really difficult to use an eye gaze device or it's really uncomfortable, then this can be something that's really good to discuss with one of your eye doctors as well. One of the other things that I'm not going to get into too terribly much, but just wanted to mention as well, is that there's also some evidence that we're starting to see about the impact of other medications that people with ALS are often taking on eye tracking. And they show up in kind of different ways on how you use a device. But one of the big ones that we're seeing is um, the use of muscle relaxants. So things like baclofen or gabapentin, um, because they are designed to, relax the muscles, it can sometimes change how your eye focuses on a specific part of the screen. Um, and so it's, it's something that we are kind of still in the process of really getting some deep research on. But something that we're definitely seeing is that when some people have tried kind of all of these pieces and they're still having trouble using their eye tracking device, that sometimes we are looking at some of these medications and seeing, if we taper off of some of these or if we take the dose down a little bit, how does that impact things? Um, and so that's something that we're definitely diving into a little bit deeper, particularly because, too, one of the things we've heard from a lot of the neurologists that we work with is oftentimes, when people are first diagnosed with ALS, one of those first symptoms can be the muscle spasms and those fasciculations and how uncomfortable those can be. And oftentimes people are put on a dose of a muscle relaxant, and then that dose is not really looked at a ton throughout the course of the disease then. And so this is something else that we're really looking at to say, is there a point when maybe we need to be discussing like, we still need to be on that high of a dose, or, are there other considerations that we should have? So that's something I wanted to throw in there as well. But that's really it. That's the meat of the piece that I wanted to share today is really just to be thinking about your eye health and think about um, how you can keep maintaining um, just your eyes and making sure that they continue to be a good functioning part because they can be a really helpful and important piece for quality of life.